Hey, this video is going to compare Medicare versus Medicaid. These are things that people talk about all the time, and it's important that you know the difference between the two because you cannot just use these two terms interchangeably, especially if you're going to be a provider or work in a healthcare field of some different type. Now, the first thing I want to talk about is that both these programs are available at the federal level, so the entire national government. They were made through the Social Security Act. They're provided for, and now the Social Security Administration handles a lot of their funding. But the big difference in the two, and I already pointed you to it, is one works with people that are elderly or disabled, and the other one works with people that are poor or destitute. So the E in Medicare, think of that as elderly. An elderly person might have a decent level of resources, or might be able to, might have used to be able to work, but now they're just they're getting older, and they don't necessarily have the same access to things like they used to. A destitute person or a poor person might be totally able to work. They're just a little bit, they're down in their luck. Maybe they lost their job, or just a series of unfortunate events put them in a position where they need some help. But in any case, there is a difference between these two programs. Now there are some cases where you don't have to be elderly to get Medicare, and those are the three exceptions that you really need to know. And I guess the first one isn't really an exception. The first one is just elderly, and currently that's defined as someone older than 65 years old. And that there's some talk right now that number might change to like 67 or what have you, but currently it's greater than 65 years old is one of the reasons why you qualify for Medicare, so if you're elderly. The other one is if you're disabled. So if you are deemed by the government to be unable to work for whatever reason, let's say you are a quadriplegic or something like that, well, that person can't very easily work a job, so they will qualify for Medicare. And lastly, this is kind of an interesting one. This one's probably one that's most commonly tested because you have to just remember it. You can't really work your way through it, and that's people with end-stage renal disease. Typically, if they require dialysis, or if they have kidneys that are really failing them, the costs are so high, etc. End-stage renal disease is also one of the three things that will qualify you for Medicare, or that E for the elderly. Now, Medicaid, the poor, the destitute. This is you can think of them more as people that don't have one of these three conditions. They are able-bodied, their kidneys are great, and they're young, but they just need a little bit of help. They are destitute. So that's Medicare with the E versus Medicaid with the D.